Vitamins and baby medicines live on the cute and safe side of the pharmacy. Colorful gummies, soft drops, syrups with fruits and cartoon characters. And because they look harmless, people assume there's no way to go wrong. But there is. Too little can cause deficiency. Too much, especially of some vitamins, can cause toxicity. And in babies, even small dosing mistakes can have big consequences. In this episode, let's talk about vitamins and baby medicines in a calm, simple way, so you respect them without being scared. I'm Ammar, a licensed pharmacist, and this is Medicine Wise. If you're a parent, or you love someone who blindly takes multivitamins just in case, hit subscribe and let's start. First, vitamins. Vitamins are essential nutrients. Your body needs them, but usually in very small amounts. There are two big groups: water-soluble vitamins, like B vitamins and vitamin C. Your body doesn't store large amounts. Extras are usually excreted in urine. Fat-soluble vitamins, A, D, E, and K. These can be stored in the body, especially in fat and liver. This means taking slightly extra water-soluble vitamins is usually less risky, but taking too much fat-soluble vitamins for a long time can lead to toxicity. For example, too much vitamin A or D over time can cause serious problems. It's not just a vitamin. Common mistakes with vitamins: taking multiple products that all contain the same vitamin without realizing the total dose. Thinking, if one tablet is good, two must be better. Using vitamins as a replacement for sleep, food quality, and lifestyle. Vitamins work best as support, not as a bandage for poor habits. Now, what about multivitamins? They can be useful when diet is poor, in some health conditions, pregnancy, or real diagnosed deficiencies, as advised by a professional. But for many healthy people with a decent diet, multivitamins may not provide dramatic magic. Sometimes they just create very expensive, colorful urine. Your SMART rule: before starting heavy vitamin combinations, ask, what is my goal? Do I actually have a deficiency, or am I just copying a trend? Now let's move to baby medicines. This is where we have to be extra respectful. Babies are not small adults. Their organs, metabolism, and doses follow different rules. Common baby medicines include paracetamol drops or syrup for fever and pain, saline nose drops or sprays for blocked or dry nose, barrier creams for diaper rash and skin protection, sometimes vitamin D drops if prescribed or recommended. 3 golden rules for baby medicines: dose by weight, not by guessing. The label usually gives a dose in milligrams per kilogram or by weight bands. Always check. Don't copy "this much worked for my nephew." Use proper measuring devices. Use the syringe or dropper that comes with the medicine. Household spoons are not accurate for tiny bodies. Be strict with age restrictions. Some cough and cold products are not recommended in very young children. And honey is not given to babies under 1 year due to risk of botulism. Also, fever in a very young baby is never something to casually treat again and again without checking. If a newborn or small infant has fever, poor feeding, unusual sleepiness, or seems not right, don't just repeat doses, see a doctor. So to summarize your SMART rules for vitamins and baby medicines: vitamins are not magic, they are tools. Identify if there's a real need or deficiency. Be extra careful with fat-soluble vitamins like A, D, E, and K. They can build up with long-term high-dose use. Don't stack multiple multivitamins together for extra strength. For babies, always dose by weight. Use the correct measuring tool and respect age limits on labels. In very young babies, fever or unusual behavior deserves medical attention, not just repeated dosing. If this helped you see vitamins and baby medicines more clearly, subscribe to Medicine Wise by Ammar and keep following this OTC series.